Hello again. I'm Dr. Nunez with Living Health. I sometimes get the question, I have high blood pressure, what can I do? Well, there's a lot that's available to you within the area of your lifestyle choices. How you live your life on a day-to-day basis can impact many chronic conditions like high blood pressure. If you like these kinds of videos that go into your choices in lifestyle medicine and what you can do, press that thumbs up, press the subscribe button, and press the little bell for future notifications of videos, and maybe leave a comment, and we might do a video on something if there are enough comments about that. So high blood pressure. What can you do if you have high blood pressure? Well, there are many things that are available to you on your day-to-day choices and how you live your life. And I'm just going to start by talking a little bit about high blood pressure. It's called hypertension, that's what we call it, and most cases of hypertension are called essential hypertension, which means we haven't really found a cause for it, but you just are hypertensive. You have high blood pressure. It's also called the silent killer. Why is it called the silent killer? Because most people have no symptoms when they have high blood pressure. So you don't know it until somebody takes your blood pressure or you take your own blood pressure and you realize, gosh, I have high blood pressure, or somebody says, by the way, you have high blood pressure. It is something that's worth taking care of because, yes, as time passes, you run an increased risk of heart disease, of stroke, of kidney disease, and these kinds of things. So yeah, pay attention to it. What can you do? Yes, you visit your doc, you can discuss it with your doc, and you can see what's available to you from the prescription drug area. But there's also a lot that you can do on your own, choices that you can make in how you live your life that keep it under control. And I'm going to start off with the area of nutrition and diet. And I'm going to link below to the National Heart, Lung and Blood Institute DASH program. DASH is Dietary Approaches to Stop Hypertension. So this is the nutritional component. I'm just going to read off some of the servings for a regular diet of about 2,000 calories. And in their webpage, it's very detailed, and you can go in and look yourself up by your age, gender, and the like, and your activity level, and it'll give you more specifics on what you might be able to do in terms of fashioning a DASH diet program for yourself. So a typical 2,000 calorie diet, they list grains, 6 to 8 servings a day. Now, that's going to be whole grains, okay? So, yes, 6 to 8 servings, just think about one serving like a slice of whole grain bread or multigrain bread. They list meats, poultry, and fish, 6 or less servings. Now, caution here, this is not a 4-ounce serving. These are 1-ounce servings. So what they're talking about here is no more than 6 ounces a day, and the lower limit, it could be none. So for you guys that are vegans or vegetarians out there, more power to you. That's great. That's okay, and that's perfectly fine. So it is just 1 ounce or less, 6 of those 1-ounce servings, okay? Preferably, by the way, when we go into this, it says meats, poultry, or fish. Fish is the preferred, then poultry, and then meat. And if you're in red meat, preferred is going to be grass-fed, grass-finished, which tends to be lower in fat and have a better balance of fats in it than your corn-finished or corn-raised cattle. Next is vegetables, 4 to 5 servings. And this could be a cupful of leafy greens, could be half a cup of, is just 1 serving. So you gotta have 4 to 5, half a cup of the chopped veggies, that kind of thing. Fruits, 4 to 5 servings a day. So that could be 1 apple is 1 fruit. So notice the scale difference here. An apple is a lot bigger than 1 ounce of meat, for instance, okay? So obviously there's a big emphasis on vegetables and fruits. And I will put it to you that if you eat that many vegetables and fruits in a day, you'll probably be pretty full and eat a lot less of the meats and a lot less of the grains. What's next? They do list here low fat or fat-free dairy products, 2 to 3 servings a day. Yes, those are ounces also. So you don't need to consume a lot of these. It depends, and they'll go into detail whether it's cheese, yogurt, or fat-free milk or dairy-free milk. And there are alternatives for those that are vegan and vegetarian, which we do encourage in the plant-based programs. You could consume these things as non-dairy milks or non-dairy cheeses or non-dairy yogurts and the like, which are available now too. And again, these are not mandatory, so you don't have to include them in your regime. The other thing, fats and oils that they talk about, 2 to 3 servings. Depending on the fat or the oil, it might be 1 teaspoon is 1 serving. I would again caution you with this to stick with the vegetable fats like oils, olive oil, or vegetable oils that are out there. Be careful with saturated fats. I would tend to avoid those even though they might come from a plant source like coconut. And then sodium. Sodium is a big one that we speak of. In this 2,000 calorie model, they talk about 2,300 milligrams. That's 2.3 grams of sodium in a day. That's salt. It's also an MSG, monosodium glutamate, that you might find in other foods or seasonings. You'd be better off to limit that even lower than that to 1,500 milligrams or a gram and a half. And when you do that, it is noticeable, the impact on blood pressure. There's also, they list here, nuts, seeds, dry beans, and peas at 4 to 5 servings a week. So that's not a whole lot either. In the whole food plant-based program or plant predominant program, we tend to consume perhaps more of the beans and legumes and a lot less of the seeds or nuts. And the reason for that are the seeds and nuts tend to be higher in fat, higher in calories. So you should be very careful with that. They also list here sweets at 5 or less servings per week. Again, it's or less. So if you're at 0, more power to you. The more you could eliminate processed sugar from your diets, the better you're going to be. Now, this is just the DASH component, okay? This is the nutritional component. And this fits very well into the model of the whole food, plant predominant eating that we speak about in the other videos that we've had. Again, there are other areas of lifestyle medicine, okay? What else might you be putting in your body that could increase your blood pressure? Well, something to look at is caffeine. I would limit the caffeine intake or eliminate it if possible, whether it's from coffee or sodas. And particularly, too, that people sometimes ignore is the teas, even green tea. And yes, some people will quote you and quote studies showing how green tea has its benefits. Yes, it does, but if you have a high blood pressure, be careful. There is caffeine in green tea, and that can drive your blood pressure up as well. So I'd urge caution on the caffeine side. Smoking, if you're a smoker, it just compounds the risks of high blood pressure. So yes, eliminate that. If you're not exercising, you need to include exercise into your diet, into your daily routine, so that it assists not just your nutrition, but your physical activity. Now, if you have very high blood pressure and your blood pressure is not under control, I would consult with your doctor what you can do and should not do. In general, you can start though with just some walking and slowly build up your walks so you can get to a point where you're routinely walking half an hour a day or an hour a day if you can get to that point. And you do that gradually and you make sure that everything else is okay, so please consult your doctor on that. What other component is there? There is sleep. Yes, I have other lectures and talks about sleep. Sleeping 7 to 9 hours every night can help you, and the routines you go into that we talk about in our tips for sleeping to help you sleep will also help you wind down and help you with your blood pressure management. So when you bring these other elements into play, exercise, sleep, nutrition, eliminating bad things in your diet. And then you add in the component of social connectedness. So you have a social network that's helping you along to be healthy, to feel good, to feel loved. That can motivate you, that can keep you going, and that can keep you emotionally and psychologically healthy also. And that will help you manage your blood pressure. When you feel a lot of stress, sometimes your blood pressure can go up. So these other components can help you manage those things that are stressful. Eliminating the toxic substances, whether it's coffee or other stimulants, can help you de-stress as well. Sleeping can help you de-stress. Those things then feed into your ability to manage your blood pressure. So I want you to notice that you can do a lot, especially if you're in those borderline areas of high blood pressure, or if you've just started to become, to have high blood pressure. If you start tweaking your lifestyle and what we've talked about, and these different areas of lifestyle, which we refer to as the pillars of lifestyle medicine, and you bring them into check, you can manage your blood pressure. And sometimes you won't need to take medicines, or if you are on medicine, they might be able to reduce the doses for you. And occasionally we have people that come off their medicines if they're able to make all these changes and live well. And again, I want to emphasize lifestyle medicine is about enjoying life too. If you're feeling deprived while trying to pursue these things, or frustrated in some way, you're probably doing something wrong, and you could take a step back and reassess. What we want you to do is enjoy life. Enjoy it to the fullest and with good health. And that's what lifestyle medicine is about. So press that thumbs up, press the subscribe button, press the little bell. If you want to get notified for future videos, leave a comment. And again, I'm Dr. Nunez from Living Health. Bye-bye.